Father's Day is this weekend, and it means it's Men's Health Week. So this morning on today's checklist, we are going over the list of all the doctors and screenings that men need. So here to walk us through is Dr. Cedrek McFadden, board-certified colorectal and general surgeon. Good morning to you, Dr. McFadden.
Dr. McFadden.
Good morning.
Let's dig in here before we get into, to the docs and that every dad needs. You found studies that highlight how being a father is both beneficial to your physical health and your mental health.
It really is. We have studies that show that men who have children have lower risk of death from heart disease compared to men that don't have children. Now, this doesn't mean just because you are a dad, you're going to have a healthy heart.
Right.
But let's think about how much work it is to actually be a father. It's a lot of work. I don't know if you ever chased a 3-year-old around the house.
Yes.
That constant activity, that whether you're coaching sports, it encourages heart health. And so there is some benefit there. We also see that when men are expecting a child, they're more likely to get rid of some of those negative behaviors. Think smoking, think excessive alcohol use, substance abuse, because they want to also keep mom safe and they want to be a good example to the child that they're raising as well.
And what about the mental health?
And the mental health, we can't ignore that. I mean, studies have also shown that men who are actively involved, and that's probably the key here, that are reading with their kids, playing with their kids, have lower rates of depression, less stress, and we also see that suicide rates are lower in fathers. And so, we definitely recognize there's benefits on both fronts.
So when I'm screaming at my children sometimes, you two are going to kill me.
No.
That's false.
It may be some therapy.
Yeah.
We'll talk about that.
So Dr. McFadden, I mean, you specialize in colorectal cancer surgeries, but when you visit patients, you encourage them to get all sorts of things checked out. What are some of the things that fathers need to make sure they're paying attention to on a regular basis?
Well, that's a great point, because when I'm taking care of a patient, I'm not taking care of just a surgical problem. I'm taking care of the whole person, right? So I can't get you through surgery if your heart's bad. So I have to make sure we're checking your blood pressure, checking for diabetes, because if you have diabetes, you may have a higher risk of having infections after the surgery. So we have to look at the whole person. So I'm going to make sure you're doing your screenings and using that as impetus. We know that 60% of men aren't seeing doctors, right?
60%?
60% of men are not seeing doctors
on a regular
basis.
Okay.
So when I get you in the office, we're going to take advantage of that time to really address all the things, fill in some of the gaps to make sure that we take care of you.
So let's get to the doctors for a second, and you've talked about this before, your PCP, your primary care physician. If your medical team is a team, the PCP is the quarterback.
That's the quarterback. I mean, that quarterback knows every position on that field, right? And they're going to know when to bring in the special teams that are going to get you what you need. So I don't want men to be afraid of if their doctor's referring them to someone, but there are times where it's necessary. One of the big ones is the cardiologist.
Right.
We know that heart disease is the #1 cause of death in men.
Is it?
And then if you think about the times you're going to see the cardiologist, certainly if you have a heart history or family history, you already are engaged. But if you're not having symptoms, you may just see a heart doctor if the doctor thinks you need to see one. Like, I was training for a marathon. I wanted to see a cardiologist to make sure I wasn't going to have a heart event. I was young, but at some point you may have to have that doc on your team.
What about the doctors that we don't normally think about?
Yeah.
Who are the doctors we should be thinking of?
So we don't think about the dermatologist that's protecting us from some of these preventable cancers. The other one that we don't think about often is the dentist. I mean, they're doing more than just cleaning your teeth. They're looking out for your oral health. And, we know that oral cancer rates are on the rise. And one of the key persons that finds these is the dentist.
Right.
So you should be seeing that dentist at least twice a year. And the other ones that we often talk about are the urologists. I mean, these are doctors that are specialists in treating the genital urinary tract. So they're treating your kidneys, your bladders, your reproductive symptoms. It's not just for older people. If you're wanting to be a father, you may need to see a reproductive specialist, or if you've already been a father and you don't want any more, you may see that same urologist.
That's right. And the ophthalmologist because you got to worry about glaucoma and stuff like that.
Even if you're not wearing glasses, you still need to have that exam.
And really quickly, your PCP, how often should men be seeing their primary care physician?
So at least once a year.
Okay.
If not more, if there are health problems. And remember, in bringing in that mental health piece as well, you got to make sure it's always a good time to talk to a therapist, even if you're young.
That's good information. I never thought about the PCP as a quarterback.
Yeah, absolutely.
Dr.
Thank you,
McFadden,
Doc.
thank you.
Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.